Hello there and welcome once again to The Verdict. Mick Cornett with Kent Meyers. We're here every week, meeting interesting people and dealing with topical issues.
Well, nothing more topical than COVID, I'm sorry to say, although there's a great guest we've got, the Chief COVID Officer for the University of Oklahoma College of Medicine, Dr. Dale Bratzler, coming back again for another appearance with us to kind of give us an update on that, but he's got some other interesting things he wants to talk about.
Fabulous. We'll get to it. You're watching The Verdict, and we'll be right back.
That interesting thing is, wants to talk.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other. And we're not going anywhere.
Military service ran in my blood, starting from my father, which joined the Navy. On the Chickasaw side, my uncle, which served in the United States Army. I'm Benjamin Espinosa, Chief Petty Officer, United States Navy, and I'm Chickasaw. I went to the Secretary of Defense's staff at the Pentagon in Washington, D.C., which ultimately led to becoming a combat support technician for Naval Special Warfare, specifically SEAL Team 10. I think to be proud and to love your tribe, to love being Chickasaw, you also have to love being American. You also have to love everything that America stands for: equality, perseverance, professionalism, and power. I want my family to know that their father is a good person, but also feels that he has an obligation to the country and to love this nation. Anything worth having is worth dying for. The military and the country owes me nothing. I owe it everything.
See more stories about the Chickasaw people at profilesofanation.com.
Set of The Verdict, Mick Cornett with Kent Meyers. Kent's going to introduce today's guest.
Well, as we mentioned in the open, our guest today, for coming back for his fourth appearance on our show, is Dr. Dale Bratzler. Dale is the dean of the Hudson College of Medicine, Hudson College of Public Health Medicine at the University of Oklahoma. He's a professor in internal medicine at OU, and he is the chief COVID officer at OU. This is his fourth appearance. Dale, welcome back, and thanks for joining us.
Yeah, good morning. It's a pleasure to be here.
Yeah. Well, Dr. Bratzler, I'd ask you what's new, but I'm almost afraid to ask what's new. What are you working on these days?
Yeah, well, I just took over as the dean of the Hudson College of Public Health, so a new role for me, working with students and faculty, increasing our enrollment, and really one of the things that we talk about a lot here in public health is building the public health workforce for the future, because we know through the pandemic we lost so many people that had roles in public health that just got burnt out and left the profession. So we need to build and be prepared the next time we have a major viral disease or something else that happens that needs public health intervention.
Well, I notice the name Hudson is in the name of the institution. Is that Cliff Hudson by any chance, or the Hudson family?
Yeah, absolutely. Cliff and Leslie Hudson created an endowment for the Hudson College, and we're so happy to be working with them.
Well, what is happening? We named this show, I think a little errantly, and I did that, as a COVID update. But give us a brief COVID update, because I know that you have some other things you'd like to talk about. Give us a COVID update if you can.
Yeah, so it's pretty hard to believe, but we're 3 years into this now. We've seen almost 1.3 million confirmed cases in Oklahoma, and sadly, a little over 18,000 Oklahomans have died from the disease. So it's had a profound impact on our state. Where we're at today, though, is much better than we were a year ago, and certainly better than we were 2 years ago. Cases have come way down, though we've seen that happen before in the springtime. We're down around 300 confirmed cases a day that are being reported to the health department. And as of this past week, we only had about 140 patients that are in the hospital. I was reflecting on the last time I was on the verdict in February of 2022, and we had just come off of the biggest peak of COVID through the entire pandemic. We had almost 2,000 Oklahomans in the hospital with COVID at that time, and we're seeing upwards of 5,000 to 6,000 cases every single day. So we're in a much better place now than we were, in 22 when I was last on the verdict, and certainly where we were a year ago.
What are the trends? Are we going to have a point in time in the future where this will be something that we used to worry about, or do we still need to remain vigilant and it's going to be that way for a while?
I think we're going to have to remain vigilant. So one of the cautions I've been pointing out, cases are way down right now, and the trend looks really good. But we've seen that happen the past 2 springs, where the number of cases dropped off only to start rising again in the summer months. So I'm just being very cautious about, watching what's happening right now. I think going forward, though, there was a nice study done at the University of Washington. And one of the things we know about the COVID virus, we're not going to eliminate it. We're going to be living with it for years to come. I tell all of the medical students and residents that I teach that COVID-19 will have to be in the differential diagnosis of any patient that comes in with an upper respiratory syndrome that results in pneumonia or other things. We're going to have to think about it. So it's not going to go away. The other thing is that I've been pointing out in many different talks recently is that the nature of the disease has changed. When it first started, particularly in the second year when we had that big Delta surge, we saw a lot of young people die with COVID-19. That's actually not the case now. We're seeing a lot of cases of COVID, but the people who have the complications and are at risk of death from the disease are people who are older, particularly 65 and older, where 90% of all deaths from COVID now occur in that age group. So the nature of the disease has changed.
Are we, with COVID, in a situation where, such as we are with the flu, where you get an annual flu shot, or at least it's offered up to you, and it's recognized that it's a wise thing to do by a lot of people? Are we going to be having an annual COVID booster routine?
So that hasn't been decided yet, though I won't be surprised. So in Europe, the World Health Organization and others have recommended that if you got that bivalent, that new booster last fall, that you consider after about 6 months going ahead and getting another booster dose, because we know that the immunity that you get from the vaccine does tend to wane over time. So I think it's very likely that there'll be some routine recommendation of COVID vaccine, though I don't know if it'll be for the entire population, because again, the serious consequences of the disease now fall on the elderly.
Dr. Bratzler, there was when COVID hit 3 years ago, there was a financial response because so many people were stopping working, and there was obviously great financial concerns about so many people not keeping the economy going. But there was also a health response that was in many ways completely removed from the economic impact. And we continue to look back at the economic response, and it's being discussed and cursed and praised, and probably will be for years. But I don't hear as much on the health response at the time. Looking back now 3 years ago, when we didn't really know what we were dealing with, how would you say that the world and the public health officials around the world dealt with the COVID crisis, and what did we learn from it now looking back with 3 years hindsight?
Yeah, so I'd say my just short answer is that we didn't do really well. We weren't prepared for the global spread of a viral disease that was quite deadly. We just weren't prepared for it. Our hospital systems, our healthcare systems across the country, and frankly around the world, just simply weren't prepared for the influx of the number of patients that we had to deal with. We weren't prepared with simple things like personal protective equipment for our healthcare workers or nurses and others so that they didn't get infected. We did lose healthcare workers. We lost quite a few, not only from the disease, but very, very quickly, many healthcare workers, nurses, doctors, and others just burned out from the sheer burden. As I mentioned earlier, we hit 2,000 COVID patients a day in the hospital in February of 2022. So we lost a lot of healthcare personnel. We weren't prepared for it. We didn't have any vaccine. And I think, you're aware that there was some information that came out that subsequently probably wasn't correct because it was a new disease. We were all learning and we didn't know exactly how to respond. I do think we learned a lot about managing viral respiratory illnesses that spread quickly. I do think that all of us have been thinking about the ways that we make sure that we have the protective equipment we need in the future should we see another episode, because as we know, pandemics do happen. This was a 100-year pandemic, but and I hope it's 100 years again, but there will be another pandemic somewhere in the future. So we have to have all those things set up. Just as healthcare systems lost workers, nurses in particular, public health agencies lost a lot of workers. So we really have a lot of work to do to rebuild our public health and our healthcare workforce.
All right, let's take a break. Dr. Dale Bratzler is the Dean of the Hudson School of Public Health down at the University of Oklahoma. We're exploring the COVID outbreak of 3 years ago, but also looking to Dr. Bratzler to talk about what he's working on currently and some things he wants to explore in the future. That'll come on the other side of this break. We'll be right back.
At Wittenberg, we're litigators. That's all we do. All of our clients, some sort of wrong has occurred to them. We try to right that wrong. Corporate America, they have all the power. It's sort of like going against an army. I like helping the underdog. That's what gets me up out of bed every day.
Our success rate is phenomenal, but that's not all they get. We care about people.
I'm very proud of what we've been able to do for our clients, and I'm looking forward to what we're going to do in the future. There's still a lot of wrongs that need to be righted.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams ranked #2 in the nation. OU Law, generations of excellence, limitless possibilities.
One of the best kept secrets about the post 9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They're there to help you find the right school for you, the school that will help you and your family make great steps into your future.
Back on the set of The Verdict, Mick Cornett with Kent Meyers, and we're visiting with Dale Bratzler, who's the Dean of Public Health down at the University of Oklahoma.
Dale, talk to us a little bit about, you gave us some really interesting numbers about Oklahoma's experience currently in COVID. Are we doing better than most? Are we doing about like most other states, or are we doing worse than other states? How do we stack up?
Well, yeah, so if you look at the overall death rate, the number of people who died per population, Oklahoma was in the top 10 states for death rates. Sadly, we really came out of the gate fast when the vaccines became available. We gave a lot of vaccine doses really quickly, but then we fell off, and our vaccination rates have just been lower. The other reason I talk about that Oklahoma didn't fare very well with respect to death from COVID is that we don't have the healthiest of populations in Oklahoma. We have a lot of people with diseases such as diabetes, chronic lung disease, and heart disease. And in fact, we're very high nationally on many of those diseases. And those people just don't do as well if they get infected with the COVID virus. So if you look, generally Oklahoma had higher rates of death than most other states. Now those death rates have dropped, which is good across the entire nation. But our vaccination rates tend to still be lower than we would like for them to be.
One of the elements of chasing down COVID was trying to trace where all the illnesses began. Have you been working on that aspect?
Well, we really aren't doing much personal contact tracing anymore. I will tell you, the health department once a week puts out numbers of cases of COVID. There are far more cases of COVID than get reported by the health department because people are doing home tests now. So there's no good way to trace contacts anymore. We do have researchers here at the university, though, that are doing wastewater sampling. So they periodically go out and sample sewage systems, and they can find traces of the virus that will tell you if an outbreak is going to occur. So they will often see the viral counts in stool start to go up higher before we even know that there may be an outbreak coming. So that work continues doing surveillance for COVID-19.
Let me change the subject just a minute and go to another disease we have to deal with often, and that's the flu. We are, I guess, coming out of the flu season now as we get into the spring. Did we have a particularly light flu season this year, or was it normal or heavy?
Well, I would say it was probably normal, maybe a little bit lighter. We got very, very high. We had high rates for a period of time. We were one of the highest rates in the nation. However, that moved around the country pretty quickly. We had about 3,000 Oklahomans who were hospitalized with the flu this year. That number is a little bit lower than it's been some years, certainly higher than we'd seen, though, the 2 previous years when people were being infected with COVID, they were wearing masks. All of those things may reduce the rate of influenza infection. So we saw an earlier outbreak this year. That was the other thing that was a bit unusual. The most common month with a peak number of cases of influenza in Oklahoma is typically January, but this year we were seeing a lot of flu in late November, early December. So it was an earlier season.
Let me follow up on that just a little bit. Are you able to do the same kind of wastewater analysis that will help you know how the flu season is going as you can with COVID, or is that limited to COVID?
No, it's not limited to COVID. In fact, there are many, many different diseases that can be monitored by surveillance and wastewater sampling. You may know of the case of polio that happened in New York State. We hadn't seen a case of polio in the United States in years, but when they did wastewater sampling, they actually found that the virus had been in the population, putting some people, those who had never gotten their polio vaccine, at risk of getting actual polio disease. So there are a number of different diseases. Flu's one of them, COVID, polio, and others that can be sampled from wastewater.
I've been reading a lot about Alzheimer's research. Is there anything new there that you feel is worth passing on to our viewers?
Yeah, I think there are a couple of things that are exciting. One is, one of the biggest problems with Alzheimer's disease is that by the time you make the diagnosis, there's already extensive damage in the brain. It's these protein, they're called plaques. I always tell people, think about a nice piece of wood that's got some some knots in it. These plaques almost look like those knots that are in a piece of wood. But those build up in the brain, and that's what ends up resulting in some of the symptoms that we see from Alzheimer's disease. But by the time you diagnose it, they often have fairly extensive disease. So some of the two exciting things are happening. One is early diagnostic tests. Researchers are doing more studies to find tests that will tell us early if somebody's starting to develop some of these amyloid plaques in the brain or some of the other biomarkers that might predict Alzheimer's disease. Because if we're going to treat it and really prevent somebody from going on down the pathway of symptoms, we have to identify it early. The second exciting area of research around Alzheimer's disease are these new monoclonal antibody drugs. You've heard about monoclonal antibodies. We use them for COVID. We use them all for all types of cancer. We use them for different types of arthritis. But now there are new monoclonal antibody drugs that seem to help attack and prevent some of this plaque formation in the brain. And so very exciting research about using those, particularly if you know somebody may go on to develop Alzheimer's disease, that you could use to prevent them from having the devastating consequences of the disease.
Do you expect recommendations from the medical community to the public at large about getting tested or to see if these pieces of wood, if you point at bumps on the brain, are starting to form? We haven't seen that before, I don't think.
No, and most of it's still in research. There are a number of research trials going on around the country to find those biomarkers that would allow us on a simple blood test to tell if somebody was at risk of going on to develop the symptoms of Alzheimer's disease. So most of it's still in research, but it's exciting that I think that we're finally starting to hear people are getting a handle on early recognition of a person who may end up with Alzheimer's disease.
So much advancement through genetics and genetic testing that's finding its way into the public health sphere. What's exciting you the most in that area?
Well, I think, I've been closely watching, some of the genetic engineering that's been going on. So the human genome has been identified. We know all the genes, and there are more and more tests that can be done to look at an individual's genetic structure to see how they might respond to individual drugs like chemotherapy agents, looking at cancers and things like that. But I think one of the most interesting things I've been kind of watching, trying to keep track of, is where you actually manipulate the genome to treat diseases like sickle cell anemia and others, where you actually replace some of the genes that have caused the problems related to a disease like sickle cell disease. That's very early in its infancy in the type of research, but there have been a few very interesting cases reported already where gene manipulation using this therapy has actually cured a disease.
Dr. Bratzler, we got about a minute left. What can our viewers do to improve Oklahoma's health if you had 2 or 3 bullet points to pass along?
Well, we need to be more active, exercise, diet. Remember that the underlying causes of diseases like diabetes, high blood pressure, heart disease are just inactivity, poor diet, being overweight. Those are the things that we really need to focus on, because if we focus on those, we'll see fewer cases of diabetes, hypertension, heart disease, which still remain the biggest killer of Oklahomans right now.
All right. Dr. Dale Bratzler is the Dean of Public Health at the Hudson School down at the University of Oklahoma. Thanks for coming on The Verdict. We really appreciate your insight.
Yeah, and thanks for all you do.
Yeah, it's my pleasure.
Kent and I'll be back with a final word after this.
This is the epidemic of my generation. This is my HIV. This is my Black Plague.
In the midst of one of our state's largest crises,
Oklahomans are dying from this preventable and treatable disease on a daily basis.
We believe there's hope.
That little pill will cause destruction through your whole life.
Watch the entire award-winning 9-part docuseries Killing Pain, made available by Fighting Addiction Through Education at killingpain.com.
It used to be okay in hospitals. It used to be okay in movie theaters. It was okay in classrooms, restaurants, and airplanes. But thanks to a greater understanding of the dangers, that's not okay anymore. So now that we know secondhand smoke causes lifelong health problems, why is it still okay to smoke with children in the car? Bottom line, it's not okay. Let's get serious about protecting kids. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
You have children come from a different lifestyle, different mindset. You have to open your arms and really do what you have to do to have that child become a part of your family. And if it's more patience, that's what you do. Kids got to know they can trust you. And that's what we've tried to do with these kids.
You will always be mom and dad to me.
Welcome back to Set the Verdict. We are wrapping up the show with Dr. Dale Bratzler of the Hudson School of Public Health down in Norman.
Yes, thanks to Dr. Bratzler, and happy birthday to the
heard
verdict. We're now 22 years old.
22 years, almost to the day since we started doing this show. 1,141 episodes when this one's over.
All good.
We got some website information. Dr. Bratzler can be reached at ouhsc.edu. And we have a website, theverdict.tv. We'll see you next week, right here on The Verdict.